As a board-certified surgeon in general and critical care surgery and professor of surgery at the UNLV School of Medicine, you don't often see Dr. Deborah Kuhls sitting still, but she is in her element. Saving lives and teaching medical students, residents, and fellows are her passions. You'd never suspect this dream job was a second career path in her life.
I actually pursued a career in the business world and in banking, and I had a good career there. But at the end of the day, I really thought about what difference am I making in people's lives.
Dr. Kuhls tells us her first memories were of wanting to be in medicine. So in her 30s, she made a 180-degree turn and started looking into the pre-med program at the University of Pennsylvania, where she was approached by the director of the pre-med curriculum.
And much to my delight, as I was contemplating quitting my middle-level management banking job and taking a deep dive into poverty, that the program director asked me one day, how would you like to go to Medical College of Pennsylvania? And I felt like, I would just love to go to Medical College of Pennsylvania.
So she did, and found she was drawn to trauma surgery, something she got a taste of while still in banking.
So when I was still in banking, for 2 to 3 years, I actually volunteered at a Center City, Philadelphia hospital as sort of a patient advocate. And during that time, I gravitated towards helping the injured patient and their families. As I went through medical school, typically in the 3rd year of medical school, we do certain core rotations. And I started off with surgery first, and I was just totally enthralled with surgery. And at night, we covered trauma call.
15 years of additional education and training in Pennsylvania and Baltimore, Maryland, produced this amazing doctor and professor who is respected and beloved by anyone who works beside her or comes before her as a patient. And fortunately for us, the chance to work at University Medical Center, a Level 1 trauma center, and teach at the New School of Medicine landed her here in Las Vegas some 22 years ago.
My final decision was the combination of being able to teach medical students in a public medical school and being a trauma surgeon at what I consider just a great trauma center in the country.
She encourages any woman with a desire to practice medicine in any form to follow her dreams.
And if practicing medicine as a physician or entering another healthcare profession really is what they want to do and would gratify them, go for it.
She's certainly glad she went for it. Teaching, research, and working with patients and their families answers that desire she was looking for when she left banking, making a difference in people's lives.
Because both the patients and their families, on the morning of injury, they got up probably and had breakfast like you and I, thinking it was going to be a normal day, but it was anything but a normal day. And to help them through that process, just even emotionally, I think is really important to me.